Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing 4 new cases of COVID-19, bringing a total to 250 cases. As of this morning, 8 individuals are hospitalized. Of that, 4 are in intensive care. 121 individuals are listed as recovered. There are 124 active cases. Yesterday, CAD and Provincial Lab performed 449 tests, bringing the total tests completed to 18,349. We again caution Manitobans to not interpret the current case numbers to mean our risk is reduced. This virus is still in Manitoba, and it's been Manitobans' strong efforts in social distancing that have kept our numbers at this level. And so it's too soon to relax those efforts. We should be encouraged that our efforts are working and we're seeing some benefits of this. We should be cautiously optimistic, but now we do not want to loosen our efforts that would allow that virus to spread again in our communities. This is reaffirming the reason why we extended the current public health orders, and today we're adding new public health orders to further our efforts to minimize the risk of this virus in our province. These orders will come in effect tomorrow and will be in place until May 1st. We'll be restricting travel to northern Manitoba and remote communities. This order is specific to communities above the 53rd parallel and to remote communities that do not have road access during the summer. Residents of the north and remote communities may continue to move within the north. The delivery of goods and services can continue. The order does not apply to government employees or healthcare providers traveling for work, families with shared parenting agreements, or child and family service workers. This will help protect the region where the spread of the virus could significantly affect the health of that population. In addition, we are now requiring anyone returning to Manitoba from a different province to self-isolate for 14 days. This will help reduce the reintroduction of the virus in Manitoba. As we see the numbers in Manitoba remaining relatively low, we know that our risk is not reduced. These extra measures are in place to minimize the risk of reintroduction of the virus into our population. We have the quarantine orders that are in effect for international travelers. Now these are going to protect against reintroduction from other provinces. We're protecting the northern communities where remote isolated communities would be more at risk for transmission of this virus and severe outcomes should it be introduced into those communities. And these measures and our continued public health efforts are being put in place to set us up for the hopeful time when we can start relaxing some of these public health measures, to have everything in place to protect the most at-risk communities, to protect against the reintroduction of the virus, but at the same time allowing us to cautiously loosen some of our public health interventions. Our other measures remain in place, including maintaining the limit to gatherings of a maximum of 10 people in any indoor or outdoor location, restaurant and bar closures, and non-critical business closures. I can confirm that garden centers and greenhouses are able to operate, providing social distancing measures are in place. All of these measures, again, are taken to flatten the curve in Manitoba, to reduce the transmission of this virus in Manitoba. We remind Manitobans that there should be no non-essential personal travel. Please cancel any non-essential travel plans. Today we are expanding our testing criteria to include all symptomatic workers or volunteers at workplaces that have been identified as essential services, all symptomatic persons who live with a healthcare worker, first responder, or worker that works in a congregate setting, such as a correctional facility, shelter, long-term care, or a residential facility. This targeted approach will help us continue to monitor the spread of the virus in Manitoba. This virus has been detected in all health regions in Manitoba, so all Manitobans need to take these precautions, to stay home as much as possible, to practice social distancing at all times, frequently hand washing, and very important, to stay home when ill. Manitobans should continue to access credible information about COVID-19. Visit our website, manitoba.ca/COVID-19, for up-to-date information. All of these measures, the effect that they're having on our relatively low numbers, shows that we've never been helpless against this virus, that our actions are having an effect, but we need to continue those actions so we do not reverse all of the gains we've made. Wash your hands, cover your cough or sneeze, stay home as much as possible, especially if you're ill. Please continue to use the healthcare system if required. Call HealthLinks if you have questions, but our health care facilities are safe when needed. And I want to thank again all Manitobans for all of your efforts to flatten our curve. And I'll pass it over to Lanette.
Thank you. Good afternoon. I want to begin today by acknowledging how difficult this pandemic has been on many Manitobans. And while we are doing everything we can to keep everybody healthy, it does come at a cost to our economy. Tens of thousands of Manitobans have already been impacted by job loss or reduction. And the financial pressures that many are facing translate to increased demand at food banks throughout the province. At the Salvation Army Food Bank in Thompson, for instance, staff there usually see 3 or 4 new requests per month, and in the past 3 weeks, they've seen 24 new requests. The need is significant. Staff at the Thompson Clinic have picked up on this demand and responded by collecting donations for the food bank. In addition to raising $1,200, they've filled large bins with much-needed food. And this is heartwarming, especially when considering that the staff at the Thompson Clinic are also busy during the pandemic running the community testing site and providing care for patients. So we congratulate the workers there for their commitment to helping the community that they live in. And we encourage all Manitobans who are in a position to help to donate to food banks within their community, because the need has never been greater. I would also like to provide some statistical updates for you. HealthLinks has received 8,534 calls on average. Their wait time has gone from a low of 1 minute and 36 seconds on Monday to a high of 11 minutes and 45 seconds on Easter Sunday. By comparison, I will note that a month ago, the wait time was 1 hour and 43 minutes. So kudos to the HealthLinks team and the digital health team for working through those challenges. Our online assessment tool has seen more than 423,000 web views since it launched a month ago, including about 18,000 views in the last week. DynaCare continues to call people with their negative results. So in the last week, there's been 3,000 calls, and in total, they've made 13,000 calls to date. And as a reminder, if you are COVID positive, the public health officials will be contacting you directly and expeditiously. And finally, I just wanted to let you know about the Manitoba Institute for Patient Safety. They are reminding patients, residents, and clients of the importance of keeping up-to-date information on their medications. So what they are recommending is an updated list be kept for yourselves, but also for emergency responders and healthcare providers to just make sure that they have current and accurate information if needed. And there if you can keep this list in your wallet or in your purse or saved on a cell phone so that it's accessible whenever anyone needs it. The Manitoba Institute of Public Safety has also provided an easy-to-complete medication card, which we've made available on our website, sharedhealthmb.ca. And with that, we can open up the line to questions.
Okay, thank you. We have a full slate of media, and our experts do have a busy schedule today, so we will take one question from each reporter. I will introduce you, and if time permits, we'll go for additional questions. Up first, from the Winnipeg Free Press, Carol Sanders.
Hi, it's Carol Sanders at the Free Press. Dr. Roussin, you said that you're expanding testing, but the number of tests being done in recent days are about half of what they were a week ago. So why is that, and how many tests a day will be performed in the coming days?
Well, we have expanded. I think there is no backlog at the lab, so the low numbers all reflect the demand, the amount of people showing up for testing. And so I think that that's our biggest indicator that we want to expand testing. Certainly, we've always been testing those at highest risk of having COVID and those at highest risk of having severe outcomes of COVID. But as we see our numbers of tests dwindling, now we're going to expand access to lower risk groups, trying to ensure we keep getting a good sampling of the population.
Thank you. From the Brandon Sun, Bud Robertson.
Not even a follow-up.
Yes, thank you. It's Bud for Lanette. A few people put out another news release today regarding adequate sufficient supplies of PPE in long-term care homes. Also saying that porters who do transport patients aren't getting any masks. And we've also heard some people who are working in homes saying they're not getting these personal protective equipment but are afraid to come forward and speak out. Can you speak to that, what is being done and what you are doing with it?
So we have meetings every day with our logistics team, and we have been assured that the PPE is being shipped out. Not everybody does need PPE, though, I will say, so there are guidelines that are out there. We do need to conserve our PPE and make sure that the people who need it have access to it. So I have received actually personal emails of people who have said they're not, they don't have it. So I can certainly follow up, but it's probably the best approach is to talk to your direct report or your manager and ask where it is, because I do understand it's been delivered. So maybe it just has to make it to the specific sites. So if it's not there yet, it will be there soon.
From CJOB, Diana Foxhall.
Good afternoon, Diana from 680 CJOB. With respect to the death of the woman in her 60s from Prairie Mountain Health Region that was announced yesterday, I'm hoping for a bit more detail on the circumstances around her death. Yesterday you said she was in hospital but not in intensive care. How did she come to be in hospital, and what are the circumstances around her acquiring COVID? Was she diagnosed before reaching the hospital, or did she get COVID in the hospital?
Yeah, well, this is all personal health information, so we still have a public health investigation ongoing, but we'd only release information like that to the public if there was some risk to the health of the public. So we'll complete our investigation. If there's some reason we need to relay that type of information to the public, we will. For the most part, we're going to respect the privacy of individuals.
From the Winnipeg Sun, Scott Billick.
A question for Dr. Brent Roussin there. Just wondering the reason, I guess, behind both kind of travel bans, one to the north and one to, I guess, are you seeing still some interprovincial travel that has been leading to cases?
Well, we've seen, about 56% of our current cases are directly related to travel. Some of that is international, some of that is interprovincial. But what we are at right now in the stage of our outbreak, where we see our curve relatively flat, although it's early, we see that the ongoing risk is re-importation of this virus. So we're putting up measures to do what we can to limit the importation of the virus into our province. And these measures are all being put in place with this. We're now in that planning stage to to see how we can start lifting some of these measures. So we're putting up these travel bans to ensure that if we do move to lifting it, we have everything in place to prevent the importation of the virus, as well as the ability to prevent taking that virus to communities where the spread would be quite risky.
From CBC Radio Canada, Mohammed.
Hello, my question was about PPE in personal care home workers, and Lanette Siragusa answered it, so I'm good. Thank you.
Thank you.
Merci. From CBC Manitoba, Bartley Kivas.
Dr. Roussin, further on, can you describe what threat is posed to Manitoba by Ontario's larger caseload and faster caseload growth?
Right, so that it's just the importation of cases. So so right now, Manitoba, because of the the gift of time and being able to see what had happened in other jurisdictions, we were able to put in some of our restrictions quite early. And so we've benefited from a relatively flatter curve. If we see other jurisdictions, certainly our neighbors to the south, but in other provinces, we see higher growth rates than there is in Manitoba. So we put those restrictions in is because we see the importation of the virus into Manitoba as an ongoing threat. So we're just escalating those efforts to minimize that risk.
From CTV Winnipeg, Michelle Gerwing.
Hi, it's Michelle from CTV. I'm wondering about PPE for family doctors. What is the, how are we getting PPE to the people who have clinics in the community?
Mm-hmm. I do understand that some of the PPE is being shipped. I cannot confirm that all of it that has been requested has gone out. I believe there's been some good collaboration with Doctors Manitoba to make sure that we can support those family physicians or primary care providers. So it will be ongoing, and I do understand that some is being shipped and more will be coming.
From the Canadian Press, Steve Lambert.
Hi, Steve Lambert from the Canadian Press. Dr. Roussin, I'm hoping to clarify two things in the release today. One, regarding the travel to northern Manitoba. Does that impact northerners who want to come south and return? And secondly, the campgrounds. It mentions here that campgrounds can provide accommodation only to recreational vehicles that act as the primary residence. Does that mean no tents or yurts in early May? We're a couple of weeks away from the campgrounds opening up provincially. So I just want to make sure whether that's just very temporary right now for the private campgrounds that are open, or whether you're now making decisions affecting provincial campgrounds in May.
Right, so all of these orders are in effect until May 1st, unless they're repealed earlier. The question about the northern travelers, so that an exclusion criteria is if you're a northern resident, so it would not prevent a person from returning home. Although our strong messaging is that should be staying home as much as possible. As far as the campgrounds, right now that does apply. It's only for those who would be using those facilities as primary residences. But again, this is something that's being revisited. We have these only in place until May, and we're going to look at everything else and look at our numbers, because the real goal is to be able to try to roll back some of these measures. What that's going to look like, I can't speak to right now. It's going to depend on what our numbers look like.
From City TV, Stephanie Lasuc.
Hi there, Stephanie Lasuc with City News. I was wondering if you can clarify, now that it's a public health order that all travelers must self-isolate for 14 days, what kind of penalties people who don't abide by that will be facing?
Yep, so they would, since it's in the public health order, they would be subject to the fines that were outlined last week. They would also be, subject to penalties under the Public Health Act, if necessary. So there is enforcement that's possible. So it was possible to enforce it before. We could use another communicable disease order under the Public Health Act, but now this order is in place for all returning travelers with some notable exceptions. And so that self-isolation is going to be required, and it's subject to penalties if it's not followed.
From the Verdun Empire Advance, Ann Davison.
Yes, hi. I'd like to ask about testing. We're a huge RHA, the Prairie Mountain. There's one test site in Dauphin, and there's a site in Brandon. Is there a chance of getting a site elsewhere, like Shoal Lake or Hamiota or Sturris?
Yeah, that is really the decision of the Prairie Mountain Health Authority. So they are looking at the demand, and the demand can shift. So it's really them who inform us of where they want to set up those assessment clinics. But there are, within our testing criteria, we do prioritize northern communities and personal care homes if they're showing symptoms. So there's more testing going on beyond the assessment clinic, but that's something that the Regional Health Authority is making the decisions on.
From Global, Marnie Blunt.
Good afternoon, Marnie Blunt from Global News. We're still hearing concerns over home care workers not having access to PPE, as well as home care workers moving between clients. We know that non-essential visits have already been suspended, but my question is, would you be looking at mandating PPE for all home care workers, and do you plan to further any restrictions by limiting the movement of home care workers to only a select few of clients or a handful of clients to reduce the risk of spreading COVID-19?
Well, we don't want to do anything that would harm patients. So if a service is required, then we want to make sure that service is delivered. We do continue to encourage the principles of infection prevention and control. So that means wash your hands often, avoid prolonged contact over 10 minutes. So all of these things are helpful. In our guidelines, we're also looking at the cloth masks and gloves potentially that clients can wear to protect. But the PPE, we do have guidelines for home care workers. We do want them to use the PPE as outlined, use it appropriately for their safety and for the clients.
All right, we'll move to an open round of questions now. Time for a few more. Once again, reporters, please identify yourself and ask who your question is for. Thank you.
Diana from the
Siragusa, can you comment on what your own wait time data has to say, showing significant wait time and patient volume reductions in all three emergency rooms since the declaration of the pandemic?
I'm sorry, Bartley, what was the question? It was regarding decreased wait times in emergency rooms?
Yeah, what do you have to say about your wait time data showing that there is significant reduction in ERs right now since the COVID-19 pandemic cleared?
Are you asking me to speculate the reason why?
I'm asking for any commentary you may have on that additional on that additional capacity. Yes, please.
Yeah, so we certainly, since our first COVID case and probably actually leading up to that, we did see a reduction in the emergency room wait times and the volumes of patients coming in, lower than we've ever seen that I can remember in several years. So, you know, I think that is partly, there's a few factors that could play into it. One is that people are not coming to emergency for the things maybe that they did before. And Dr. Roussin has mentioned several times at these media conferences that if you need medical care, you really should be seeking medical care, whether it's your primary care provider or the emergency room. But there may be a reluctance to come just to add to the system impact or avoid the COVID virus, so that may be happening. And the other thing that, we don't know for sure, but it could be related to the fact that people are staying at home. And for those that live with chronic disease, it might be benefiting just the average person about spreading all viruses, not just COVID. So I can't really explain why it's happened. But we agree it is happening, and it's been happening now for many weeks. And we may actually experience a rebound at some point too.
Steve Lambert from the Canadian Press. I just would like to clear up something on the Northern Health Order. It might just be the wording of the press release, but it says the exemption for Northern residents is that they are residents of Northern and remote communities may continue to move within the North. And my question is, are they allowed to come south and return north? Are there any restrictions for Northern residents that way?
No, so the one exclusion is that Northern residents are always allowed to return home. So if they did come south, then they would be allowed to return home. And in that, the section that you brought up there was just to clarify that it's the restriction of travel to the north, not a restriction of travel within the north.
Hi, it's Diana from 680 CJOB on a follow-up question. For Dr. Roussin and Ms. Siragusa, just a follow-up, I don't think this compromises patient privacy legislation. Are you able to say if the woman who was reported as Manitoba's fifth death from COVID-19 yesterday acquired COVID-19 in hospital, or did she have the virus prior to being admitted?
Yeah, well, that we do have an ongoing public health investigation into that, so I don't have anything to announce on that. So if such time, when we find things out, if there's a reason to announce it publicly, then we definitely will.
Hi, it's members of the Free Press. I'm just wanting to know, how will the new orders be communicated to the public and enforced?
Yeah, so good question. So one is through events like this. It's going to be posted online. Enforcement is going to continue with some checkpoints that will be set up, as well as some other notifications that are being worked on right now. So, again, I think that it's important to communicate this message out. We want to get the message to Manitobans that yes, we all should be looking at our efforts that are paying off, but now we certainly can't reverse course right now. For now, we need to continue our efforts. These are enhancements of that, and these enhancements are being put in place to start that path to lifting some of our other measures.
Dr. Roussin, hello, it's Anne with City News. When you say checkpoints, do you mean a checkpoint on Highway 6 going to the north?
There could be some that are set up. There's nothing definite right now on what those exactly going to look like, but that's one thought, is to have similar to what we've had at the provincial borders, just passing out information, doing some checks to ensure people are traveling appropriately. So this is going to take effect tomorrow. We're looking at a few different options on what the enforcement is. But again, the most important thing is messaging, because we know most Manitobans follow our advice. They follow orders. And so it's just important to have the messaging out there, and then we look at things like enforcement as an afterthought.
Ann Davidson from Empire Desk.
We've seen you've expanded testing today. The Prime Minister has said we need mass rapid testing. What would the next step in expanding testing be? Would we see something like expanding testing to everyone with symptoms, like has been done in Alberta? What would the next step on that be?
Yeah, so if you look at our list now, we're pretty close to that. We know that we've restricted a number of non-critical businesses, but the list of exceptions to that is quite vast, and so anyone on that list could be tested now. So moving forward, the next step might be to just open it to all symptomatic individuals. It really depends on what our numbers tell us. And so it's just important to ensure that we're testing those that are at highest risk of acquiring COVID or those that are highest risk should they acquire COVID to have severe outcomes. And we've already been doing that. Now this expansion is to less risky individuals, but it's an expansion to keep our numbers up.
Ann Davidson from the Empire Advance. Is antibody testing, is that a federal jurisdiction, or can you legislate that to yourself, Dr. Roussin?
Yeah, lab testing, we can certainly do that at the provincial level. It's a part of health services, and so we're not doing antibody testing right now. It is being looked at in nationally and a number of jurisdictions, and it can play an important role when you're managing an epidemic. But there's nothing right now at this point going on, but we're certainly looking into it.
Dr. Roussin, just briefly, could you explain the reasoning behind keeping greenhouses open still?
Yeah, I think it's a bit of the timing of things. We look at a number of analogous businesses. So a number of the big box stores are selling these type of products as well, and are remaining open because they are in the exception group. So we looked at these specifically. The timing of the year, we want Manitobans to be able to spend time in their yards. It's a great way to be active and to be and to still be social distancing. And we looked at the ability to ensure social distancing is going to be maintained, and so we moved with that.
Diana from CJOB. Just a question on kids who would normally be getting vaccines at school kind of throughout the school year. What are the parents of those kids supposed to do if their child was maybe scheduled to get a vaccine? They're not now because they're not in classes. Is this something they should reach out to their doctor, or what's kind of the situation on that?
Yeah, so the routine childhood immunizations, we've advised that they should continue. And these are the vaccines such as measles and both doses of that, and then certainly the new infant schedule. The school-based immunizations, I think that we're looking to probably just try to catch up next year with that. And so anyone who is concerned could certainly reach out to their primary care physician. But for the most part, we're going to continue those immunizations when school is back in.
Thank you. Dr. Roussin, Bartley Hughes here at CBC. How are you going to enforce the self-isolation period on Manitoban cottagers who continue to go to northwestern Ontario and against advice not to do so?
Yeah, so I think the messaging is we continue to do that messaging. It's really stay home as much as possible. If you're going to be going to the cottage, you need to really minimize your contact with anyone else. It should be not stopping at the gas station, not stopping at a local store, not having friends over. And so it's really important that these next weeks are critical. And so the advice is to stay home. Certainly in our provincial in the order regarding provincial travel, there is that 50-kilometer buffer zone, which is representative of the local epidemiology as well. And so those individuals would not be required under that order to self-isolate for 14 days.
Sorry, Sir, can you clarify that, though? You just said anyone coming back who wasn't essential has to self-isolate. That buffer zone is still in place?
On these orders, there is that buffer zone in these orders as well.
Dr. Roussin, Steve Lambert from the Canadian Press. The order you gave today concerning northern Manitoba, I believe that results from the new legislation that was passed in the legislature yesterday. Are you looking at other regional breakdowns, such as cottage country, to enforce the advice you've given of people not to travel?
Not at this second. We are constantly reviewing our numbers and what type of steps we need to protect Manitobans. So nothing's certainly off the table. Right now, we felt the northern travel restriction was what's important at this point, as well as the interprovincial travel. So those are what we have in place right now. But yeah, well, as things come up, depending on our numbers, depending on the trajectory of our outbreak, we're prepared to make changes, whatever it takes to protect Manitobans.
Michelle Growing from CTV. I'm wondering, Lanette, if at the beginning of this you were talking about cancellation of surgeries and postponing screening. Have you had to do as much of that as you plan to, or where are we with that?
Yeah, with surgeries, we have decreased quite significantly, close to 50% for the elective procedures. We've carried on, obviously, with cancer and any trauma surgery, anything that would be life-altering or have negative outcomes if we did not proceed. So that has gone on, and as Dr. Roussin looks at the exit strategy, we'll have to look at ramping up those services again. Because sustaining that long term is challenging for sure.
And Dr. Roussin, can you explain why the 53rd parallel was the cutoff point that you decided to go with?
That's sort of relatively arbitrary. It's what's often defined in a number of pieces of legislation and regulations as the North. So we just decided to use that for our order when we define the North. And so we'll see, the utility of that for now. We can always change that if needed.
Okay. All right. If there are no other questions, we will conclude our conference. Thank you, everyone. Have a good day.
Thanks.
You.